Dr. Montalban, thank you for being part of Multiple Sclerosis News Today, official coverage of CONI, and to agreeing to film this interview. So, as a researcher focused on the use of MRI in MS diagnosis, do you believe that MRI will also become a valuable tool in the monitoring of disease progression and lesion burden in clinical practice?
In clinical practice, you are not talking about activity, you are talking about progression, which is a little bit more difficult. We have a number of measures nowadays, being the main one, brain atrophy. But still, when we are studying cohorts, when we are studying groups, brain atrophy is very useful. At the individual level, that's a little bit more complicated too. So we still don't know exactly how to monitor one single individual using brain atrophy or other techniques, for instance MTR or whatever. We need still a little bit of time to use this at the individual level.
Okay. The clinical interpretation of complex MRI results can be difficult, and brain atrophy assessments can differ depending on the MRI hardware and software used. Given this, do you think there is a need for standardization among healthcare facilities in order for the technique to be considered a reliable and precise tool in disease and treatment monitoring?
Yes. That's another important question. From the technical point of view, this is very, very challenging and depends on the MR you're using. There's a very nice experiment done by the Munich group indicating that the same patient performed the MRI the same day in 3 different machines and they get completely different results. So we have to be very careful. Even using the same soft, the different machines can make a difference. So still a long way.
And lastly, with MRI gaining an interest in clinical importance, research on reliable MRI biomarkers of MS pathology would likely be required. Do you agree?
The biomarkers,
yes.
Biological biomarkers? Yes. Well, we have a number of biological biomarkers nowadays, diagnostic ones. They are very clear, anti-NMO, oligoclonal bands, so and so. Others still need some clarification and some validation. For instance, neurofilaments A, which are the more, prominent ones for treatment response. Many of them, in fact, require CSF taps, which is not a common procedure in a number of countries, mainly in the U.S. So we need blood biomarkers just to monitor our patients in terms of prognosis, in terms of treatment response. But I'm very optimistic on this specific aspect as well. Yeah.
Okay. Thank you very much, Doctor.
Welcome.
Thank you.